Hello everyone. Today we are going to discuss about health issues and habits to avoid. Here we see good habits and bad habits. So let's start. Firstly, we start with health issue regarding diabetes. Habits to avoid eating late at night. Diabetes and habits to avoid. Diabetes is a chronic health condition that affects how your body turns food into energy. It's mainly characterized by high blood sugar levels due to the body's inability to produce enough insulin or use insulin effectively. Habits to avoid for diabetes management. First, eating late at night. As highlighted in the image, eating late can impact blood sugar levels and overall health. Second, unhealthy diet. Consuming high amounts of sugary food, saturated fats, and refined carbs can worsen the diabetes management. Third, lack of physical activity. Not exercising regularly can lead to poor blood sugar control. Fourth, stress. High stress levels can affect the blood sugar levels. Next, how to manage diabetes. Eating a balanced diet with whole foods like veggies, fruits, whole grains, and lean proteins. Engaging in regular physical activity like walking or other exercises. Monitoring blood sugar levels regularly. Following a healthcare provider's advice for medications and lifestyle changes. Next is health issue regarding hypertension. Here we see habits to avoid is using too much salt in the food. Hypertension or high blood pressure is a health condition where the force of blood against artery walls is too high. It can lead to serious health issues like heart disease, stroke, and kidney disease. Using too much salt in the food, it consuming excessive salt can increase blood pressure in some people. High sodium intake can lead to fluid retention, causing blood pressure to rise. It reducing salt intake is often recommended for the people with hypertension to help manage their condition. And how to manage your hypertension? Limiting sodium intake to less than 5 grams, about 1 teaspoon per day. Eating a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. Engaging in regular physical activity. Monitoring blood pressure regularly. Next is health issue regarding migraine. Habits to avoid: skipping meals. Migraines are a type of headache disorder characterized by recurrent episodes of severe headaches, often accompanied by sensitivity to light, sound, or other symptoms. Skipping meals and migraines. Skipping meals or fasting can trigger migraines in some people. Low blood sugar levels due to skipping meals might contribute to migraine onset. Eating regular, balanced meals can help manage blood sugar levels and potentially reduce migraine frequency. How to manage migraines? Identifying and avoiding personal triggers like skipping meals, stress, and certain foods. Maintaining a consistent eating schedule. Staying hydrated. Considering medication or other treatments at advice by the healthcare professional. Next is health issue regarding acid reflux. Habits to avoid: lying down after meals, as we have seen in image. Now, acid reflux, also known as gastroesophageal reflux, occurs when stomach acid flows back into the esophagus. Lying down after meals can worsen this condition. Why lying down after meals triggers acid reflux? Gravity's effect reduce. When lying down, gravity doesn't help keep stomach acid down in the stomach. Increased chance of acid flow. This can lead to stomach acid flowing back into the esophagus, causing symptoms like heartburn. Tips to manage acid reflux. Wait before Lying down. Wait at least 2 to 3 hours after eating before lying down. Elevate head while sleeping. Elevating the head of the bed can help reduce symptoms. Next, health issue regarding gastritis. Habits to avoid eating too fast. Gastritis is inflammation of the stomach lining. Eating too fast can contribute to gastritis. How eating too fast affects gastritis. Increased stress on the stomach. Eating quickly can lead to poor digestion and increased stress on the stomach. Less chewing. When eating fast, food isn't chewed properly, which can lead to larger food particles entering the stomach. Potential for irritation. This can potentially irritate the stomach lining and contribute to gastritis. How to manage gastritis? Eat slowly and mindfully. Chew food thoroughly to aid digestion and reduce stomach stress. Balanced diet. A balanced diet with less spicy or acidic food can help manage gastritis symptoms. Consult a healthcare professional for personalized advice on managing gastritis. Next, health issue regarding heart disease. Habits to avoid is physical inactivity. Heart disease is a major heart health issue that can be influenced by lifestyle factors, physical inactivity, and heart disease. Physical inactivity is a habit to avoid to reduce the risk of heart disease. Regular physical activity helps maintain a healthy heart and cardiovascular system. Sedentary behavior like prolonged sitting or minimal exercise can increase the risk of heart disease. How to reduce the risk of heart disease? By engaging in regular physical activity like walking, jogging, cycling can help lower the risk of heart disease. Aim for at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise per week as per general guidelines. Then consult a healthcare professional for personalized advice on exercise and heart health. Next is health issue regarding anemia. Habits to avoid drinking tea with meals. Drinking tea with meals can be a habit to avoid if you are concerned about anemia. Why drinking tea with meals might affect anemia? Iron absorption. Tea contains compounds like tannins that can inhibit the absorption of non-heme iron found in plant-based foods. Impact on iron levels. It reduces the iron absorption, which can contribute to iron deficiency anemia over time. Next, tips for tea drinkers. Timing of tea consumption. To be considered drinking tea between meals instead of with meals to minimize impact on iron absorption. Dietary balance is to ensure a balanced diet with iron rich foods to counter the potential effects. Next is health issue regarding asthma. Habits to avoid being in dusty environments. Being in dusty environments can worsen asthma symptoms or trigger asthma attacks. Why dusty environments are a concern for asthma? Dust as a trigger. Dust particles can irritate the airways, leading to inflammation and constriction. Common sources of dust are construction sites, dusty roads, or areas with poor air quality can expose individuals to high level of dust. How to manage asthma around dust? Avoidance. Minimizing time in dusty environments can help manage asthma. Precautions to be taken: using mask or taking medications as prescribed by a doctor can help when exposure to dust is unavoidable. Next is health issue regarding gut issues. Habits to avoid not drinking enough water. Not drinking enough water can contribute to gut issues. Why hydration matters for gut health, digestion, and bowel movements. Water helps in proper digestion and prevents constipation. Symptoms indicators: signs like dry eyes, headaches, dry skin, and feeling tired, confused, or angry might indicate inadequate hydration. What are the importance of adequate hydrations? So, overall health, like proper hydration, supports various bodily functions, including gut health. Prevention of issues. Drinking enough water can help prevent gut related problems like constipation. Next is health issue regarding liver issues. Habits to avoid eating processed foods. Here we are seeing some images related to liver issues. These are the image of processed, ultra processed foods. So, explanation. Eating processed foods can negatively impact liver health. Why processed foods are a concern for liver health? So, additives and preservatives. Processed foods often contain additives and preservatives that can strain the liver. Unhealthy fats. Some processed foods are high in unhealthy fats, which can contribute to liver issues like fatty liver disease. How to promote liver health? So, there are some choices dietary choices. Opting for whole unprocessed foods like fruits, vegetables, lean proteins, and whole grains can support the liver health. Next is limiting processed foods. Reducing intake of processed foods can help minimize potential negative impacts on the liver. Next health issue is regarding to kidney stone. Habits to avoid watching TV for hours. Kidney stones are hard deposits made of minerals and salts that form inside the kidneys. Connection to watching TV for hours affects sedentary behavior. Watching TV for extended periods is a sedentary activity that can contribute to overall inactivity. Indirect impact on kidney health. While watching TV itself isn't a direct cause of kidney stones, a sedentary lifestyle that can impact overall health, including factors like hydration and weight management, which can influence kidney stone risk. Prevention and consideration. Stay hydrated. Drinking plenty of water helps prevent kidney stone formation. Balanced diet and activity. A balanced diet and regular physical activity supports overall health and may reduce the risk of kidney stones. Next health issue is regarding vitamin D deficiency. Habits to avoid staying indoors. Vitamin D is a crucial for bone health and immune function. The body produces vitamin D when skin is exposed to sunlight. Why staying indoors can contribute to vitamin D deficiency? Limited sun exposure. Staying indoors reduces exposure to sunlight, which is a natural source of vitamin D. Impact on vitamin D levels. Reduced sun exposure, which can lead to lower vitamin D levels. Addressing vitamin D deficiency. It balances indoor and outdoor time. Spending time outdoors, especially during peak sun hours with sun protection, which can help maintain vitamin D levels. Diet and supplements. Vitamin D can also be obtained through diet, fortified foods, fatty acids, or supplements if necessary. Next health issue is regarding insomnia. Habits to avoid using screens late at night. Using screen late at night can contribute to insomnia due to several factors. Are as follows. How screen time affects sleep. First, blue light emission. Screen emit blue light which can suppress melatonin production, a hormone that regulates sleep. Second, stimulating content. Engaging with screens before bed can be mentally stimulating, making it harder to wind down. Third, disruption of sleep patterns. Late night screen use can delay sleep onset and reduce sleep quality. Next is managing screen time for better sleep. First, limit screen time before bed. Try to avoid screen at least an hour before sleeping. Second, use night mode or blue light filters. Many devices have features to reduce blue light emissions in the evening. Here we are completed all the explanations regarding the health issues with their habits. Hopefully this video will helpful to all, and don't forget to like, share and subscribe my channel. Thank you.